Forget everything you think you know about VR being just gaming. Right now, in hospitals across America, doctors are prescribing virtual reality like medication. Surgeons are practicing on virtual hearts before they ever touch real patients. And Fortune 500 companies are training millions of employees in worlds that don't exist. If you think VR is still years away from mattering, you're already living in the past. Before we dive into this chapter, if you learned anything from Chapter 1, click the subscribe button and tell me what you learned in the comments section. So, let's start with healthcare. At Cedars-Sinai Medical Center in Los Angeles, doctors have begun prescribing VR experiences to patients managing severe chronic pain. The results are remarkable. Studies show that immersing burn victims in snowy virtual landscapes can reduce their pain perception during wound care by up to 50%. 50%? That's not a minor improvement. That's transformative. The technology is also revolutionizing mental health treatment. For PTSD, therapists used to rely on imagination or photographs. Now, they can place veterans in controlled virtual environments where they gradually confront traumatic scenarios in their own time, at their own pace. A study by the University of Oxford demonstrated that VR therapy helped individuals with severe paranoia reduce their fears by placing them in progressively challenging social situations, starting in an empty virtual cafe, then gradually moving to crowded subway cars, busy streets, and social gatherings. The progress is measurable, and it's real. Now, let's talk about education. Medical schools like Stanford University are transforming how they teach anatomy. Instead of crowding around a cadaver, students can walk inside a beating heart. They can examine valve movements from perspectives literally impossible in physical reality. Surgical residents practice complex procedures hundreds of times in VR before ever touching an actual patient. Think about that. You get to make every mistake in a risk-free environment before it matters. Walmart took this concept and ran with it. They trained over 1 million employees using VR simulations for Black Friday chaos and active shooter scenarios. The immersive training improved retention rates and employee confidence compared to traditional video-based learning. That's 1 million people getting better trained through virtual reality. In the business world, major automotive companies like Ford and BMW are using VR to design vehicles collaboratively. Engineers in Detroit, designers in Munich, and executives in Shanghai can stand inside the exact same virtual prototype, adjusting dimensions and materials in real time. This has reduced their design cycle times from months down to weeks. That's not just efficiency, that's a complete reimagining of the collaborative process. Architecture firms are doing something similar. Instead of showing clients flat blueprints on paper, they present building designs as walkable experiences. Clients can literally walk through a building before it exists, catch spatial problems before construction begins, and make changes when they're still just pixels instead of when they're concrete and steel. These real-world applications are just scratching the surface. Doctors are healing pain without pills. Students are walking inside beating hearts. But if this is what's possible right now, imagine what's coming in the next 5 years. And that's where things get really interesting, because the advantages of VR go far beyond what most people understand. We're talking about technology that could fundamentally change what it means to be human, to create, to feel. But before you get too excited, you need to hear both sides of this story. Because for every incredible advantage, there's a dark side that Jaron Lanier desperately wants you to understand. Next in Chapter 3, we'll dive into the benefits first, because they're genuinely amazing. See you next time. If you enjoyed this chapter, click the subscribe button so you don't miss the next chapter.